Circulatory system. Introduction. Materials in the human body need to be taken from one organ to another and to the tissues, from where they are distributed to each and every cell of the body. Thus requires movement of material called circulation. It is a vital process of the body which is accomplished by a system called circulatory system. The circulatory system is an organ system that transport nutrients, gases, hormones, blood cells, nitrogen waste products, etc. to and from cells in the body to help fight diseases and help stabilize body temperature and pH in order to maintain homeostasis. This system is composed of the cardiovascular system, which distributes blood and lymphatic system, which distribute lymph. Human beings and other vertebrates possess a closed cardiovascular system. In a closed system, the blood never leaves the network of arteries, veins, and capillaries. Human blood circulatory system. The most important means of transport of food, water, waste, and gases in human body is blood. For its circulation throughout the body, blood requires a system called blood circulatory system, also known as cardiovascular system. This system consists of heart and blood vessels. Human heart. Human heart, Greek word cardia, is muscular pumping organ. It is conical in shape and is generally about the size of your tightened fist. It is found on the left side of the thoracic chest cavity. Heart is covered by a tough double membrane called pericardium. This membrane protects the heart from overextension, especially when we run or take a hard exercise. Both the membranes are slightly apart, and in between them present a small cavity called pericardial cavity, filled with a fluid. The pericardial fluid, which lubricates the heart to ease the movement and protect the heart from any mechanical injury. Structure of heart. Heart consists of four chambers. Two auricles, also called atria, and two ventricles. Heart is composed of cardiac muscles, which are specialized type of muscles keep working day and night untiringly. Atria are smaller and thin-walled, separated from each other by an interauricular septum. They form the interior portion of the heart. Ventricles are larger, thick-walled chambers, also separated by ventricular septum. Right atrium communicates with right ventricle through a valve called tricuspid valve. It is called tricuspid because it consists of three flaps of muscles. And left atrium opens into left ventricle through bicuspid valve having two flaps. This is human heart. These valves control the blood flow and blood is allowed to flow only in one direction. Function of heart. The right atrium receives the deoxygenated blood through vena cava, largest vein, from the whole body. This happens when the heart relaxes and space is produced inside atrium. The body is forced to right ventricle through tricuspid valve. When the heart contracts, the deoxygenated blood from right ventricle is pumped to the lungs through pulmonary arteries. During this, the tricuspid valve is kept closed, preventing the backflow. After oxygenation, the blood comes back to left atrium through pulmonary veins. The semilunar valve in pulmonary vein allows the deoxygenated blood to go to lungs and prevent its backflow. From here, via bicuspid valve, oxygenated blood is sent to left ventricle. On contraction, the oxygenated blood is pushed with full force into aorta, the largest artery which distributes it to whole body through the smaller and smaller arteries. Like other mammals and human beings, as well as the oxygenated and deoxygenated blood is completely separated. Deoxygenated blood remains on the right side of the heart and oxygenated on the left side of the heart. Values play a very important role in this regard by preventing the backflow of blood. Cardiac cycle. One contraction and one relaxation is called cardiac cycle. Contraction of heart is termed as systole and relaxation is diastole. One complete cycle takes 0.8 seconds. The contraction and relaxation are cyclic and rhythmic. In the first phase, called diastole, blood flows in the four chambers passively. In second phase, for example, systole, both the auricles contract together for about zero point 0.1 second filling the ventricles completely with blood. Then, in third phase, the ventricles contract together for about zero point 0.3 seconds, pouring blood in the aorta and pulmonary artery. Normal rate of heart in a healthy human being is 72 beats per minute. This rate decreases when a person is resting or sleeping and increases to 120 beats per minute during strong muscular exercise like running, swimming, and with some medicine like caffeine. Every time heart pours about 85 milliliters of blood into aorta with a great pressure. Blood travels in all different types of vessels at different speeds. Speed is fastest in arteries, slower in arterioles, and slowest in capillaries. From here, it starts getting collected in venules. Its speed starts increasing in venules and faster again in veins. The continuous working of heart is due to certain specialized structure like SA node, also called pacemaker, AV node, and some specific type of fibers called Purkinje fibers. The pacemaker or SA node, sinoatrial node is the impulse generating pacemaker tissue located in the upper dorsal wall of the right atrium of the heart. Near the entrance of the superior vena cava, SA node initiates the electrical impulses for heartbeat and keeps the blood in motion. The cells of SA node generate electrical impulses faster than other cells and are responsible for rest of the heart electrical activity. SA node is thus sometimes called the primary pacemaker. Dysfunction of SA node causes disturbance in heartbeat, either becomes very fast or very slow, or sometimes combination of both. Another very important structure in AV node, atrioventricular node, which is the part of electrical control system of the heart. Its main function is to coordinate heart rate and electrically connects arterial and ventricular chambers. It is an electrical relay station between the atria and the ventricles. Electrical signals from the atria must pass through the AV node to reach the ventricles. This node slows down the speed of the electrical signals to delay the contraction of ventricles until the atria are not fully contracted. Purkinje fibers were discovered in 1839 by John Evangelista Purkinje. These fibers extend in the form of branching tree in heart and play an important role in its continuous working. Purkinje fibers are the extension of autonomic nervous system. They are found in the inner wall of the ventricle just beneath the endocardium. These are specialized myocardial fibers which conduct electrical signals, nerve impulses to different areas of heart to enable it to work in a coordinated way. In certain heart disorders, natural pacemaker fails to generate impulses for heartbeat, then an artificial pacemaker is implanted near AV node. This pacemaker is an electronic device which automatically generates electric impulses after every zero point 0.8 seconds. Electrocardiogram. The electrocardiogram is a electrocardiograph used for recording the electrical activity of the heart. For this purpose, its electrodes are placed on the chest skin at specific locations. Doctors use it to monitor the electrical working of the heart. The information is used to discover heart rate, arrhythmias, myocardial infarctions, atrial enlargements, ventricular hypertrophies, and bundle branch blocks, etc. The principle employed for recording the electrical impulse ECG is quite simple. When the overall electrical current of the heart goes toward a particular lead, it registers a positive deflection. Those that go away from the lead register a negative deflection. Those which are at 90 degrees are perpendicular to the vector of the lead register 0. For example, as seen as an isoelectric line. Reading of ECG requires following convention to be kept in mind. Recording of ECG is 25 mm per second, which results in 1 millimeter is equal to 0.04 second, or each individual block. 5 millimeter 0.2 second are between two dark vertical lines. This is electrocardiograph and this is ECG machine. The voltage recorded from the leads is also standardized on the paper where 1 millimeter, 1 mV are between each individual block vertically. The scissor and 5 millimeter, zero point 0.5 mV are between two dark horizontal lines. 10 millimeter, 1.0 mV. This is how it is usually marked on ECG. ECG reading. The phases of heartbeat can also be divided into sections relating to the shape of the electrical signal produced when viewing the heartbeat via an ECG electrocardiogram. This stresses the electrical activity of the heart. The wave shape produced is called the QRS wave, with each part of the wave being labeled to help describe what is happening at each stage. TP interval ventricular diastole. Atria and ventricles are relaxed, blood is flowing into the atria from the veins. As the atrial pressure increases above that of the ventricle, the AV valves open, allowing blood to flow into the ventricle. P wave atrial systole, the SA node fires and the atria contract, causing atrial systole, which forces all blood into the ventricles, emptying the atria. newer interval end of ventricular systole. The AV valves remain open as all remaining blood is squeezed into the ventricles. These electrical impulse from the SA node reaches the AV node, which spreads the signals throughout the walls of ventricles, where specialized cells called bundles of His and Purkinje fibers. The R peak is the end of ventricular systole and the start of the stole. Blood vessels. The circulatory system consists of three types of vessels: arteries, capillaries, veins. Arteries, the vessels which carry blood away from the heart are called arteries. All the arteries transport oxygenated blood except pulmonary artery. The only artery which carries the oxygenated blood from heart to the lungs is pulmonary artery. Arteries being very elastic resist flow of blood which is maintained through a very strong pushing force during ventricular contraction. The wall of an artery is made of three layers. The outer elastic layer, tunica externa, is made of areolar tissues and many layers of elastic fibers. These fibers give elasticity to the artery to expand and withstand the pressure of blood. Very large blood vessels require their own blood supply. This is found in the form of network of small arteries called vasa vasorum, means vessels of vessels. This network is also found in tunica externa. Middle layer tunica media is composed of circularly arranged smooth muscles and favored elastic fibers. Inner layer tunica interna or endothelium is comparatively thinner layer. It is composed of simple squamous epithelium and a thin layer of areolar connective tissue. Arterioles are the smallest arteries with a diameter ranging from 3 mm to 10 micrometer. Larger arterioles have all three layers, but smaller arterioles have only two, a thin layer of endothelium surrounded by a single layer of smooth muscle fibers. Arterioles play an important role in the vasoconstriction and vasodilation. Innervation of sympathetic nervous system cause contraction in the muscular layer of the arteriole, resulting in vasoconstriction of arteriole. Thus decreases the flow of blood into capillaries, resulting a rise in blood pressure. In contrast, the vasodilation of arterioles increases the blood flow in the capillary, which results in a decrease in blood pressure. The largest artery of the body is aorta, which arises from left ventricle. It divides and redivides into smaller and smaller branches, which make arterioles. Arterioles finally break up into capillaries when they reach tissues capillaries. In circulatory system, the smallest blood vessels are capillaries. Their diameter is 8 to 10 micrometer. Their wall is only 1 cell thick and is very permeable. These very thin walls of capillaries allow the exchange of water, oxygen, dissolved nutrients, and waste products, etc. In between capillaries and the cells of the tissues, a capillary is so thin that only one RBC passes through it at a time, releasing its oxygen by diffusion to the cells. The very small diameter of the capillaries provides simple time to blood for exchange of materials. After releasing nutrients to tissues, capillaries start joining to form venules. Flow of blood in the capillaries is adjusted by precapillary sphincters. A precapillary sphincter is a band of smooth muscle that encircles each capillary branch at a point where it branches off from the arteriole. Contraction of the precapillary sphincter can close up the branches, stopping the blood flow. If the sphincter is damaged or cannot contract, blood can flow into the capillary beds at high pressure. When capillary pressure are high, fluid passes out up the capillaries into interstitial space and edema or fluid accumulation is resulted. Veins. Veins are the vessels which bring the blood back from different organs of the body towards heart. All the veins transport deoxygenated blood except for pulmonary vein, which brings oxygenated blood. Walls of the vein are composed of the same three layers, but the middle layer is thinner as compared to that of arteries. They are less elastic as they do not have to bear systolic pressure. Most of the volume of blood is contained in veins. The reason is that instead of providing resistance in the flow of blood, like arteries, they expand to accumulate additional volume of blood. The average pressure in the veins is only 5 to 10 millimeter Hg. In arteries, it is 100 millimeter Hg. The veins have a very low pressure of blood, which is not sufficient to take the blood to the heart. They keep values which allow the flow of blood in one direction, for example, toward heart and prevent back flow. Veins passing through skeletal muscles get help to return the blood to the heart from the messaging action of the skeletal muscles. Venules at 200 micrometer diameter after coming out of tissue start joining with each other to make venlets and larger veins. The largest veins in the body are superior vena cava, which brings deoxygenated blood from head and upper region of the body, and inferior vena cava, which brings blood from lower parts of the body. Path of blood through pulmonary and systolic and systemic circulation. When a heart contracts and forces blood into the blood vessel, there is a certain path that the blood flows through the body. The blood moves through pulmonary circulation and then continues on through systemic circulation. Pulmonary and systemic are two circuits in the two-circuit system of higher animals with closed circulatory system. Humans and other mammals have two circuits circulatory system. One circuit is for pulmonary circulation to the lungs. Pulmon mean lungs, and the other circuit is for systemic circulation, the rest of the body. As each atrium and ventricle contract, blood is pumped into major blood vessel and from there continues through circulatory system. Exchange of material. The most important function of blood circulatory system is to transport oxygen and nutrients to the cells of the tissue and remove the metabolic waste products from the tissues and transport them back to the organs responsible for their excretion. In the alveoli of the lungs, oxygen binds to heme, part of the hemoglobin filled in RBCs. Blood also absorbs nutrients, especially glucose, from villi found in walls of small intestine and comes back to the heart. The blood is pumped into the aorta with full force of the contracted ventricle. From aorta, it moves into branching arteries and then arterioles. When this blood, loaded with oxygen and nutrients, reaches capillaries, due to the low concentration of these material and tissues, oxygen and nutrients diffuse out of the walls of capillaries and enter tissues. The concentration of waste material is more in tissues, so they diffuse into the capillaries. Due to the pressure of blood, some water also oozes out of the capillaries. As interstitial fluid, this water increases the osmotic pressure outside the capillaries. Therefore, at venous end of the capillaries, water again diffuses back to the capillaries along with dissolved waste products. Control of the capillary beds. It has been estimated that an adult human being has some 60,000 miles of capillaries with a total surface area of some 800 to 1000 meters square, an area greater than 3 tennis courts. The total volume of this system is roughly 5 liters, the same as the total volume of blood in human body. However, if the heart and major vessels are to be kept filled, all the capillaries cannot be filled at once. So, a continual redirection of blood from organ to organ takes place in response to the changing needs of the body. During rigorous exercise, for example, capillary beds in the skeletal muscles open at the expense of those in the viscera. The reverse process occurs after heavy meal. That Note the increase in blood supply to the working organs, skeletal muscles, and the heart. The increased blood supply to the skin aids in the dissipation of heart produced by the muscles. The total blood flow during the exercise increases because of a more rapid heartbeat and also a greater volume of blood pumped at each beat. Blood pressure. We know that rhythmic pumping of heart pours the blood into the arteries. This pulsation can easily be felt in those arteries like radial artery, which are near to surface of the skin, and we generally call it pulse. The throb we feel as pulse is due to the pressure of blood, which makes the elastic layer of arteries to expand rhythmically, allowing blood to pass through. The force per unit area that blood exerts on the inside wall of blood vessel called blood pressure. It is measured in millimeter of mercury mmHg. It is measured with the help of an instrument called sphygmomanometer. Blood pressure is of two types: systolic blood pressure, which is felt during the ventricular contraction; diastolic blood pressure, which is felt during ventricular relaxation. Systolic blood pressure is greater than the diastolic pressure. The blood pressure is generally expressed as a ratio in which numerator shows the systolic and denominator reflect the diastolic blood pressure. An average healthy adult human being has a blood pressure of 120 over 80 mmHg. With increasing age, the normal value of blood pressure also increases due to decrease in the elasticity of blood vessels. The blood pressure is generated by contraction of the left ventricles. Left, therefore, blood pressure is highest in aorta as the arteries branch and travel greater distances from the heart. The blood pressure decreases in capillaries. The difference between systolic and diastolic pressure disappears. In capillaries, blood pressure is about 40 millimeter Hg. It decreases to less than 20 millimeter Hg when the blood leaves arteries and further drops in venules. The pressure of blood is minimum when it enters the right atrium from upper and lower vena cava. Certain sensors, nerve endings are located in blood vessels of the human body called neuroreceptors. They detect the pressure of blood flowing through them and can send messages signals to the central nervous system to increase or decrease total peripheral resistance and cardiac output. They work as short-term blood pressure regulation mechanisms. Baroreceptors detect the amount of stretch of the blood vessel walls and send a signal to the nervous system in response to stretch. Baroreceptor can be divided into two categories: high pressure arteries, baroreceptors, low pressure baroreceptor, also known as cardiopulmonary or volume receptors. High pressure arterial baroreceptors are present in the aortic arc and the carotid sinuses of the left and right internal carotid arteries. The baroreceptors found within the aortic arc enable the examination of blood being delivered to all the blood vessels via the systemic circuit, and the baroreceptor within the carotid arteries monitor the blood pressure of, of the blood delivered to brain. Low pressure baroreceptors are found in large systemic venal caval veins and in the walls of the right atrium of the heart. The low pressure baroreceptors are involved with regulation of blood volume. The blood volume determines the mean pressure throughout the system, in particular in the venous side where most of blood is held. The low pressure baroreceptors have both circulatory and renal effects. They produce changes in hormone secretion which have profound effects on the retention of salt and water and also influence intake of salt and water. The renal effects allow the receptor to change the mean pressure and system in the long term. Cardiovascular disorders. Many disorders are associated with circulatory system. Some of significant are following: thrombosis and embolism. Thrombosis is Greek word which means blood clot. It is formed by aggregation of platelets inside the vessels. The disorder in which a person generates a thrombus in a vessel is called thrombosis. A thrombus in a blood vessel is very painful. A thrombus, a large blood vessel, decreases blood flow through that vessel, but in a small blood vessel, it may completely stop the blood flow, resulting in the death of tissue supplied by that vessel. Risk of thrombosis increases in certain conditions like atrial fibrillation, heart valve replacement, a recent heart attack, extended periods. Generally, bedridden patients and people like barbers who keep standing for hours as part of their daily routine suffer from this disorder. The thrombus, which dislodges and becomes free-floating, is termed as an embolus. The term embolus was coined by Rudolf Karl Porco in 1848. An embolus migrates from one part of the body through blood circulation and causes a blockage of blood vessels in another part of the body. In thromboembolism, the thrombus from a blood vessel is completely or partially detached from the site of thrombosis. The blood flow will then carry embolus, the blood vessel, to various parts of the body where it can block the lumen and causes vessel obstruction or occlusion. One of the most commonly recognized problems caused by embolus is called coronary thrombosis. In this case, the thrombus blocks the coronary artery, causing myocardial infarction, commonly known as heart attack. Even worse situation appears when the thrombus blocks an artery to the brain. This is commonly called a stroke. A stroke may result in sudden death or paralysis of the body. Atherosclerosis and arteriosclerosis. Atherosclerosis is the condition in which wall of artery thickens as a result of deposition of fatty material. such as cholesterol. It develops from low density lipoprotein molecules, LDL becoming oxidized by free radicals. Deposit cholesterol has narrowed lumen. This is very dangerous situation. When oxidized LDL comes in contact with the wall of an artery, a series of reactions occur to repair the damage to the artery wall caused by oxidized LDL. The body's immune sends specialized white blood cells called macrophages and T lymphocytes to absorb the oxidized LDL, forming specialized foam cells. These are lipids, cholesterol. Unfortunately, these white blood cells are not able to process oxidized LDL. They grow and then rupture, depositing a greater amount of oxidized cholesterol into the artery wall. This triggers more white blood cells and the cycle continues. As a result, the artery becomes inflamed. The cholesterol plaque causes the muscle cells to enlarge and form a hard cover over the affected area. This hard cover causes the artery lumen to become narrow. Narrowing up artery reduces the blood flow and increases blood pressure. Atherosclerosis typically begins in early adolescence and is usually found in most major arteries, yet as a symptomatic and not detected by most diagnostic methods until it grows to a serious threat to health. There are various anatomic, physiological, and behavioral factors which increase the risk for atherosclerosis factor add to each other multiplicatively, with two factors increasing the risk of atherosclerosis. Fourfold studies show that hyperlipidemia, high level of fats and blood, hypertension, and cigarette smoking together increases the risk of 7 times. Instead of medication are the first method of treatment advised by the doctor throughout the world is to stop smoking, change feeding habits and choice of food, and practicing daily exercise or at least daily walk. If these methods do not work, medicines are usually the next step in treating cardiovascular diseases. If atherosclerosis leads to symptoms like angina pectoris, then it becomes necessary to start medication. Physical treatment which are helpful in short term include angioplasty, procedure that may include stents to physically expand narrowed arteries, and major invasive surgery such as bypass surgery to create additional blood supply connection that go around the more severely narrowed areas. Arteriosclerosis, it is a hardening, stiffening, or loss of elasticity of the arterioles. It is often due to hypertension. The most common sites of arteriosclerosis are arteries in the brain, kidneys, heart, abdominal aorta, or legs. Symptoms of arteriosclerosis vary according to the arteries which are affected. Leg pain when exercising might indicate peripheral arterial disease. Sudden weakness or dizziness could be caused by an obstruction in the carotid artery in the neck, which produces stroke-like symptoms. Chest pain or symptoms of heart attack might indicate obstruction of the coronary arteries. Risk factors for arteriosclerosis are more or less similar as that of arteriosclerosis. They include smoking, obesity, High blood pressure, high serum cholesterol, stress, and diabetes. A family history of early heart disease is also a risk factor for developing atherosclerosis. Congenital heart problem. Congenital heart defect is a defect in the structure of heart and large blood vessels of a newborn baby. Most of these heart defects either obstruct blood flow in the heart or vessel near it or cause blood to flow through the heart in an abnormal pattern. Defect may also occur affecting the heart rhythm. Heart defects are among the most common birth defects and are the leading cause of birth defect related deaths. Congenital heart disease can be categorized into different types. In some babies, right ventricle or the left ventricle fails to develop. As a result, only one side of the heart pumps the blood, the body, and lungs. This defect is called hypoplasia of the heart, which is rare but is most serious from the congenital heart defect. Other type of defect may be called as obstruction defect. Obstruction defects occur when heart valves, arteries, or veins are abnormally narrow or blocked. Common obstruction defects include blockage of pulmonary valve, aortic valve, and bicuspid aortic valve. Any narrowing or blockage can cause heart enlargement or hypertension. The most common among the congenital heart defects are the defects in the septa of the heart. The septum is a wall of tissue which separates the left side of the heart from right side of the heart. The defect may be in septum between arteria or the septum between the ventricles. Due to this defect, blood flows from the left side of the heart to the right side. Thus, mixing up oxygenated blood and deoxygenated blood reduces the overall efficiency of the heart. Septal defects may or may not cause cyanosis depending on the severity of the defect. Sometimes the defect is so minor that it requires to treatment and is corrected by itself with the passage of time and increasing age. Major defects require medication and surgery. Blue baby. One of the effects of congenital heart defect is the birth of blue babies. It's a physiological condition called cyanosis. The reason for the appearance of blue color is the formation of carboxyhemoglobin instead of oxyhemoglobin in the blood because of limited availability of oxygen. During embryonic life, heart of the fetus start beating after 4 months of gestation. In the heart of the fetus, an opening foramen well connects the right atrium with left atrium. The blood passes from right atrium to the left without passing through lungs. The reason for this bypass is that the supply of oxygen to the fetus is from the blood of the mother through placenta and not by the lungs. After the birth, the foramen well closes spontaneously, but in some babies it does not close completely. When the baby exerts force during crying and movement, the deoxygenated blood from the right atrium enters the left atrium through partially opened foramen. When the hemoglobin of this venous deoxygenated blood turns to carboxyhemoglobin, it imparts blue discoloration to the skin, lips, ears, and other organs of the baby, resulting in cyanosis or blue baby. Hypertension. Hypertension is a chronic medical condition in which a person suffers persistently from high blood pressure. As you studied under section of blood pressure, the normal blood pressure of a healthy normal adult is 120/80 millimeter Hg, and with increasing age, the normal BP also increases. For a normal adult, a mercury reading of 130/90 is considered hypertensive. For a woman of above 45 years of age, BP 160/95 is considered hypertensive, whereas for a man, this limit is 140/95. Hypertension can be classified essential or primary hypertension, secondary hypertension. Primary or essential hypertension means that no medical cause is found to explain the raised blood pressure. Secondary hypertension indicates that high blood pressure is a result of another condition such as kidney disease, Cushing syndrome, a disorder in which both adrenal glands can overproduce the hormone cortisol, or tumors are due to medication such as ibuprofen and steroids. Persistent hypertension is one of the risk factors for strokes, heart attacks, heart failure, and arterial aneurysm, and is leading cause of renal kidney failure. Prevention and treatment of hypertension. Hypertension can be treated by weight reduction, weight loss, regular aerobic exercise, reducing dietary intake of sugar and table salt, by taking a diet rich in fruits and vegetables and low fat and fat free dairy foods, by discontinuing use of tobacco and alcohol, reducing stress and tensions. Severe cases, antihypertensive medicine are also used. Hypotension. Hypotension is the opposite of hypertension. Hypotension is abnormally low blood pressure. It is considered as physiological state rather than a disease. Not always, but most often, hypotension is associated with shock. Hypotension can also be life-threatening. The initial symptom of hypotension is dizziness. If the blood pressure is sufficiently low, fainting and often seizures will occur. Patients with hypotension also complain chest pain, shortness of breath, irregular heartbeat, and headache. The most common cause of producing hypotension is reduced blood volume in the body. This reduction in the volume of blood can result from hemorrhage, blood loss, insufficient fluid intake, as in starvation, excessive fluid losses from diarrhea or vomiting, or if often induced by excessive use of diuretics. Some medicines can also produce hypotension as a side effects. Angina pectoris. Angina pectoris or simply angina is a severe radiating chest pain due to lack of blood supply to heart muscle, generally due to obstruction or spasm of the coronary arteries. Main cause of angina is atherosclerosis of cardiac arteries. Pain of angina starts from left side of the chest and radiates to left shoulder, neck, and sometimes cerebral region. Angina is the first alarm of the body to show that something is going wrong with the heart. Those who realize and start precautionary measures and bring change in their lifestyle and diet, they lead a successful and active life. Those who do not care and continue with their lifestyle generally come across a heart attack. It is a common experience that people survive in first two attacks, but mostly third attack is fatal and result in heart failure. Treatment of cardiovascular disorders. The above description you studied many ways to prevent and minimize different cardiovascular diseases. These ways help the patient to certain extent, but sometimes doctor advise major or minor surgery or some other modern ways to provide relief to the patient. Among these methods, some are angiography, angioplasty, coronary bypass, Open heart surgery. Angiography. Angiography is a test that uses an injection of liquid dye to make the arteries easily visible on X-rays. An angiogram is commonly used to check the condition of blood vessels. There are alternatives nowadays to angiography such as CT scan, MRI scans, nuclear scans, and ultrasound scans, which often produce information as accurate and useful as angiograms. Angioplasty. One method of treatment of a blocked artery is angioplasty. The term angioplasty is a combination of two Greek words, agios meaning vessel and plastos meaning formed or molded. It is a technique of mechanically widening a narrowed or obstructed blood vessel. Typically, as a result of atherosclerosis, in this treatment, a balloon-tipped catheter is passed in the artery. At the site where the lumen is narrowed due to blockage, the balloon is inflated to a fixed size using water pressure, some 75 to 500 times more than normal blood pressure, 6 to 20 atmospheres. This high pressure removes blockage and opens the artery. Stent insertion, stent expansion, stent remains in coronary artery for lifetime. Sometimes, to ensure that the lumen remains open, a metallic ring called stent is placed there at the site. This stent remains there as part of the artery and ensures that the artery remains open. The angioplasty is not restricted to the coronary arteries. Now, other arteries which get narrowed by atherosclerosis are cleared and opened by this procedure, generally called peripheral angioplasty. This type of angioplasty includes renal artery angioplasty, carotid angioplasty, cerebral arteries angioplasty, etc. Coronary bypass or open heart surgery. Another treatment is called coronary artery bypass surgery, also called coronary bypass or simply bypass. In this treatment, a vessel is taken from some other part of the body and is grafted from aorta to coronary artery system. This vessel starts supplying blood to the heart muscle bypassing the original blocked artery. This surgery is usually performed with the heart stopped, necessitating the usage of cardiopulmonary bypass techniques are available to perform bypass on beating heart, so called up pump surgery. A successful graft typically lasts around 10 to 15 years, which means this process sufficiently improves the chances of survival of a patient suffering from atherosclerosis. Open heart surgery. Any surgery where the chest is opened, a surgery is performed on the heart muscle valves, arteries, and other structure is termed as open heart surgery. The term open refers to opening of chest and not the heart itself. The heart may or may not be opened depending on the type of surgery. As for sometimes heart is non-functional, a heart-lung machine, also called cardiopulmonary bypass, is usually used during conventional open heart surgery. It helps provide oxygen-rich blood to the brain and other vital organs. The definition of open heart surgery has become confusing, with the new procedures being performed on the heart through smaller incisions. There are some new surgical procedures being performed that are done with heart still beating and is generally termed beating heart surgery. Retractor, pericardium, heart. Lymphatic system. Lymphatic system is a network of vessels found in vertebrates that carry milky fluid called lymph. It is also includes the lymphoid tissues through which the lymph travels. This system transports and returns material from the tissues of the body to blood. In 1652, the lymphatic ducts in the liver were first described by a Swedish Olaus Rudbeck in 1630, 1702. And the very next year, it was Thomas Bartholin who described these vessels in the whole body and gave them the name of lymphatic vessels. Lymph vessels at certain points have masses of connective tissues called lymph nodes. These nodes, more than 100 in human body, are present in the armpit, groin, and neck region. These are the sites of lymphocyte production and storage. They act as barriers to infection by filtering out and destroying toxins and germs. The largest body of lymphoid tissue in human body is the spleen. Position of lymph nodes. Lymph nodes generally occur in groups along the larger lymphatic vessels. They are distributed throughout the body, but they lack the tissues of the central nervous system. All lymph nodes have the primary function of the production of lymphocytes, which help defend the body against microorganisms and against harmful foreign particles and debris from lymph before it is returned to the bloodstream. The nodes are mostly located in following six areas: cervical region. Nodes in this area are grouped along the lower border of jaw, in front, up and behind the ears, and deep in the neck along the larger blood vessels that drain the skin of the scalp, face tissues of the nasal cavity, and the pharynx. The axillary region. These nodes are in under arm region and receives lymph from vessels that drain the arm, the walls of the thorax, the breast, and the upper walls of the abdomen. Lingu- Inguinal region. The nodes in this area receives lymph from the legs, the outer portion of the genitalia, and the lower abdominal wall. The pelvic cavity. The nodes are appear mostly along the path of the blood vessels within the pelvic cavity and receive lymph from the lymphatic vessels in the area, abdominal cavity. Within this area, nodes occur in chains along the main branches of the arteries, the intestine, and the abdominal aorta, thoracic cavity. These nodes occur between the lungs and lung, the windpipe, and bronchi, and receive lymph from this area and from the internal wall of the thorax. Large lymphatic vessels, generally called lymphatic trunks, drain lymph from the larger areas of the body. These trunks then join one of two collecting ducts: thoracic duct, the right lymphatic duct. These collecting ducts finally drain the lymph into the subclavian veins to become part of the plasma. Just before the blood returns to the right atrium of the heart, the lymphatic vessels are present wherever there are blood vessels present in the body. They are joined by a capillary system when the blood passes through arteries, veins, and capillaries. The water, along with certain salt, some plasma proteins, etc., ooze out in tissues, passes. This fluid is called interstitial fluid. Interstitial fluid bothers the cell in the tissue space. From here, this fluid is collected in the fine, very permeable, bland-ended capillaries of lymphatic system in the palm of lymph were joined to make larger vessels. The lymphatic vessels transport this excess fluid to the end vessel without the assistance of any pumping action. This system is very important for distribution of fluid and nutrients in the body. because it drains excess fluid and protein so that tissues do not swell up. Our body also eliminates the products of cellular breakdown and bacterial invasion through the system. It filters out organisms like bacteria, viruses, and fungi that cause diseases. Product produces certain white blood cells called lymphocytes. Spleen is lymphatic organ. The spleen has an effect in protecting the body by clearing worn out red blood cells and other foreign bodies from the bloodstream. The spleen contains lymphocytes and macrophages, which can engulf and destroy bacteria, dead tissue, and foreign matter. Lymphatic system and cancer. The study of lymphatic drainage of various organs is important in diagnosis, prognosis, and treatment of cancer. Lymph nodes can trap the cancer cells. If they are not successful in destroying the cancer cells, the nodes may become sites of secondary tumors. Diseases of lymphatic system. Problems with system can impair the body ability to fight infection. Hawkins disease is an enlargement of the lymph nodes in the neck. Pressure on adjoining organs and nerve endings can result in a dysfunction of vital organs or in paralysis. Key points about circulatory system. The circulatory system is an organ system that transport nutrients, gases, hormone, blood cells, nitrogenous waste products, etc. to and from cells in the body to help to fight diseases and help stabilize body temperature and pH to maintain homeostasis. One contraction and one relaxation is called cardiac cycle. Contraction of heart is termed as systole and relaxation as diastole. The pacemaker or SA node is the impulse generating tissue located in the upper dorsal wall of the right atrium of the heart. Near the entrance of the superior vena cava, electrocardiograph ECG is a medical device used for recording the electrical activity of the heart. A capillary is so thin that only one RBC passes through it at a time, releasing its oxygen by diffusion through the cells. The very small diameter of the capillaries provides ample time to the blood for exchange of material. Most of the volume of blood is contained in veins. The reason is that instead of providing resistance and flow of blood like arteries, they expand to accumulate additional volume of blood. The force per unit area that blood exerts on the inside walls of blood vessel is called blood pressure. Blood pressure is of two types: systolic blood pressure, which is left during the ventricular contraction, diastolic blood pressure, which is felt during ventricular relaxation. Certain sensors, nerve endings, are located in blood vessels of human body called baroreceptors that detect pressure of blood flowing through them. Thrombus is a blood clot which is formed by the aggregation of platelets inside vessels. The disorders in which the person generates a thrombus in a vessel is called thrombosis. Hypertension is a chronic medical condition in which a person suffers persistently from high blood pressure. Angina is severe radiating chest pain due to the lack of blood and oxygen supply to the heart muscle, generally due to obstruction, spasm of coronary arteries. A surgery where the chest is opened and surgery is performed on the heart muscle, valves, arteries, or other heart structure is termed as open heart. The lymphatic system is a network of vessels found in vertebrates that carry a milky fluid called lymph. Lymph vessels at certain points have masses of connective tissues called lymph nodes.